Welcome to Facebook Live. I'm Sherrod Brown. It's an honor to serve the people of Dayton and Columbus and my whole state, and to serve this country. So thanks for joining us. I'm joined today by two Ohioans, Ms. Molly Ravine from Columbus, Ohio, and Ms. Neldra Glasper from Dayton, Ohio. They have wonderful stories to tell you, and you will hear about it from them about getting affordable health coverage. Thanks to the improvements we made in the Affordable Care Act this year and in the American Rescue Plan, they will give you the details. You have the reason for this call today for Facebook Live and featuring these two Ohioans is that there are 11 days left to shop for savings and change your healthcare plan, or for signing up for coverage for the more Affordable Health Care Act, and that's simply go to healthcare.gov. The Biden administration special enrollment period to get covered ends on August 15th. So I urge you, if you want to change your plan or if you need healthcare coverage, go to healthcare. Go to healthcare.gov really this week. Even if you already have coverage, you may be able to find a new, cheaper plan that saves you money every month. And in the American Rescue Plan, Democrats made sure that more people than ever before will qualify for help paying for health coverage, even those who may not have been eligible in the past. Most people currently enrolled in a marketplace plan may qualify for more tax credits, which obviously means lower premiums. Since then, 1.5 million Americans have signed up for health insurance through healthcare.gov. That includes 35,000 Ohioans who just signed up this year. I've talked with people all over our state who tell me how tough it is to afford health insurance and what the ability to save money and get coverage through the Affordable Care Act, the old term Obamacare, what that coverage means to them and their family. You are about to hear from two of them, so I'll start with Ms. Ravine from Columbus. Tell us your Affordable Care Act protect you, Ms. Ravine, and welcome.
Thank you, Senator Brown, for asking me to be a part of your show. A couple years ago, I got divorced, and while my children, as part of the settlement, while my children remained on their father's health insurance plan for coverage, I needed to get my own health insurance, and I was working part-time at the time. And at the time, I received the name of a navigator on the marketplace who was going to enroll me in health insurance. And so it was very affordable for myself and my situation. And it was good peace of mind. And she was quite experienced and knowledgeable and knew exactly what to do to enroll me, which was very helpful. And today I still got part-time work. I work 2 part-time jobs that I very much enjoy, and still each year enroll in the marketplace for insurance. And it is very reliable for me to be able to go to a navigator to be able to enroll and easily done.
Good, and I like how you said it, put your mind at rest, and that peace of mind is so important because of the trauma. I went through a divorce many years ago and the trauma that brings and the anxiety of what's next, and I'm glad that things have worked for you well in that way. So Ms. Glasper from Dayton, Ohio, tell us your story if you would.
Well, I signed up for HCAC. At the time, I was working for my own nonprofit and couldn't afford to have medical coverage. And all my children are grown and gone, so I applied for HCA at that time, and I applied for a $58 plan. But my story is slightly different than Ms. Ravine, because shortly after I applied, I became seriously ill and ended up with the hospital with necrotizing fasciitis, which is a flesh-eating bacteria, where only 1 out of 5 survived. If it wasn't for the American Care Act, I would not be able to afford the health care coverage that I received. I ended up in ICU. I was in the hospital for 3 months, off and on for a year, with 42 surgeries and procedures later. And I still covered up on the insurance. And at that time, I took out a $58 plan. But my son ended up contacting CareSource, who ended up being the person that was covering my insurance, and asked them, could he up the premium so I can get the best care coverage? So he went to a $300 plan so I can have all the coverage that I needed because I had to be on a ventilator and I went into a coma. So that's my story. And if it wasn't for the AC, I don't believe I would have had the good coverage that I needed for them to fight to save my life.
Well, you look good and you sound good. And I saw Ms. Ravine's response or reaction when you said that. And I assume speaking for her too, we're glad you're the one out of the 5 that survived. So, and that's the whole point of healthcare, to protect you when things really go badly. So thank you for both for sharing your story. Stories like these are exactly why we need to continue to protect and to expand the Affordable Care Act. It's made a difference in so many lives. And if you're an American, you should, nobody, particularly in this country, nobody should be left behind left exposed without health insurance. And that's the whole purpose of this. So I'm glad it worked with the two of you. And remember, people can go to healthcare.gov to shop for plans before the August 15th deadline. You can possibly save money. You can possibly get better health insurance. You make that decision. This empowers you to look at healthcare.gov, make the decision what's best for you, and sign up if you need to, or make a change in your plan if you need to. So Ms. Ravine, thank you. Ms. Glasper, thank you. And I look forward to seeing you in person in Columbus and Dayton one of these days. So.